Whether you're into reading fiction, nonfiction, fantasy, or romance, we celebrate books in February with I Love to Read Month. The Winnipeg Public Library is putting on many different programs this month to celebrate literacy. Joining us now from the Winnipeg Public Library is Aileen Clear. Good morning, Aileen.
Good morning.
Thank you so much for joining us. Now, I love reading, but it's even more special when it's I Love to Read Month because you're celebrating all together literacy. How important is literacy?
Literacy is incredibly important to development of children for doing everyday activities and their future. So learning to read at a young age, being read to, is so critical.
And it helps them in all the other arts as well, science, math, all of it.
Yes, yeah. You need to be able to read a math textbook, science, and that, so for sure.
And developing a love for reading is lifelong and can help you throughout every facet of your life as well, right?
Yeah, and it's so critical to finding a book that you love to read. Okay. And whether that be a graphic novel or audiobooks, yes, audiobooks are reading, so and library staff can help with that.
Because it actually triggers synapses in your brain, whether you're listening or whether you're reading, it's good for you mentally.
Yes.
Okay,
yeah.
So let's talk about some of the programs. You brought some books here. We're going to get to those in just a moment, but let's talk about some of the programming that's happening this month for I Love to Read at the Winnipeg Public Library.
Yeah, so all the programs, of course, are free at the library branches. We have programs in the evenings and every Saturday for the month of February. So you can come in. We have magicians, musical acts, author visits such as Tasha Spillett, Michael Redhead Champagne, and we also have, if you're not wanting to brave the cold, we do have songs and puppetry in Anishinaabe at home, and that's with John Paul Chalikoff and Puppet Bobby, and you can view it via Zoom, so you don't even need to leave the comfort of your own home.
That sounds perfect, and there's really sort of things happening for the entire family as well.
Yes, yeah. So we have readings, kind of come with for early literacy programs, read and play, Duplo makers. So that's all going on at the library branches. Some require registration, and some you can drop in. So if you look at the library website or give the branch a call, they can help you with that information and signing up for them.
Okay, and of course February is also Black History Month, and you are also highlighting that. You brought some really wonderful books this morning. Tell us a little bit about these books and the stories they tell.
Yeah, so Black History Month, we update our Black authors book list every year to feature Black authors when we can Canadian. So I've brought a few here, one of which is a horror, which isn't always featured well, which is the first one there, Out There Screaming, by edited by Jordan Peele.
And we know Jordan Peele makes really spooky movies.
Yes.
Yes.
Yeah,
okay.
so he features excellent round of Black authors, including Canada's own Nalo Hopkinson. And these are a range of stories from kind of sci-fi, body horror, or just kind of on the weird spectrum.
So it's a collection of short stories.
Just a collection of short stories, yeah, which is great. If you find an author that catches your eye, you can explore further their works.
Yeah, and it's really great too because it doesn't take you very long to get through a story.
No.
And then if you're intrigued, you just keep going.
Yes.
Okay, so what else do you have here?
So we have a book, Dear Black Girls, by Shanice Nicole. Now that it is a poem that they wrote, and they thought, oh well, eventually I would love to make it into a children's book, and so they have, and it just affirms the importance and for all Black girls that they are loved for who they are and that. So it's just a really wonderful, affirming poem.
And this is geared to what ages?
So this one I would probably, it could be anyway from 5 up to 12, I'd say.
Nice. Okay, what else did you bring?
So we have a graphic novel called Dreamer by Akim Aliou. They were born in Ukraine and they immigrated to Canada, and they loved to play hockey, and so they actually played for Calgary Flames in the NHL.
Okay.
They did experience a lot of racism from teammates and coaches, and because of that, they created, them as well as others created the Hockey Diversity Alliance.
Wow, and so that is a really beautiful book to look at as well.
Yeah.
And it tells a really important story.
Yes.
Okay, Aileen, thank you so much. Again, if you want more information on some of the programming happening at the Winnipeg Public Library, we have a link on our website. Thank you.
Thank you.
Yeah, great programming to help you escape the cold because it's sticking around. All week long, we're going to be feeling these below seasonal temperatures, though we should start to get some slight improvements tomorrow, although the conditions may not improve because right now we're enjoying the sunshine and it's looking gorgeous out here, but it does have us stuck in the deep freeze, at least to kick off our morning. Minus 27, but it feels like minus 37, even though the winds are light, just 15 clicks out of the west. Pressure rising, humidity sitting at 76%, and yeah, clear but cold, as often is the case. And across the province, all of us enjoying that sunshine. We're starting to see the clouds building, and they will continue to do so throughout the day today. Temperatures, they're not improving a whole lot though. High of minus 18 today in Winnipeg, with similar temperatures expected all across the province, either in the high teens or the low 20s. And these wind chill values, even though the winds are light, in the high minus 30s this morning, or even low minus 40s for some, and even they aren't likely to improve a whole lot, still stuck in the high minus 20s or low minus 30s as we warm up today. Now, enjoy that sunshine because that'll be disappearing with heavier clouds moving in overnight and bringing a round of snow through tomorrow. Not just tomorrow, Thursday, another snow day, but the temperatures improving ever so slightly, just into those low minus teens, but still below the seasonal minus 10. We're going to stay there right throughout this coming weekend. I love this shot. So many people were sending in pictures of the sun dogs, but this one had the little pretty dog in the foreground. Thank you to Mike and Lily who posed for us. And keep the pictures coming, please, to Winnipeg weather at ctv.ca.
CTV Morning Live Weather brought to you by Canadian Footwear, where size does matter.
Beat the winter blues by planning your summer chill. Get Pollywood patio furniture from Strictly Amish. 20% off all February. Eco-friendly and weather-resistant. Order now to get in time for deck season. Strictly Amish, exclusively in Smitty's Furniture in Arbor.
How old is knob and tube wiring? It's older than TV, radio, flight, even the automobile. It's older than anything you plug into it. If you have knob and tube wiring, it's time to upgrade. Expert Electric. Let us modernize your home.
Reconnect with your food. Be inspired to cook with local ingredients. Learn about Manitoba's farmers and ranchers. Hi, I'm Des Daniels, host of Great Tastes, and we're excited to launch our 35th anniversary season with you. Every Saturday evening, we share delicious recipes made with ingredients grown by Manitoba's farmers. Discover the best our province has to offer. Visit greattastesmb.ca, where every ingredient tells a story.
Great Tastes is brought to you in part by Manitoba's farmers and ranchers.
Everyone loves a good deal, especially one with options. Lots of options. You know, mix it up a little bit. Make it your own and get your combo your way. Now that's a deal. I mean, why get just pizzas if what you really want is pizza and chicken? Maybe add salad or pasta. Rest assured, no matter what you choose, Santa Lucia's best combo is quality ingredients, great tastes, and excellent value. Santa Lucia Pizza. It's all about the combo.
Yeah, I work, but money is super tight. I was making decisions between food or rent. Food won. Now, we're living here, in our van.
Right now, there are fewer than 100 apartments in Winnipeg, with rent under $1,000 a month. Supporting Siloam Mission makes food, shelter, and housing possible.
Casinos of Winnipeg presents One Night with the King, direct from Las Vegas, April 30th at Club Region Event Center, featuring 3 world champion Elvis performers in one big night, capturing the greatest musical eras of Elvis's career. One Night with the King, April 30th at Club Region Event Center. Tickets at Ticketmaster.ca and casinosofwinnipeg.com.
CTV Morning Live is brought to you by Robin's Donuts, your favorite stop.
A new report shows that more people are living with a congenital heart disease. In fact, according to the Heart and Stroke findings, 9 out of 10 babies born with CHD will now survive into their adult years. But there are so many challenges for patients as they get older. Joining us now are cardiac patient Carol Lobb and pediatric cardiologist Dr. Reeni Soni. Good morning to both of you.
Good morning.
Thank you so much for joining us.
Thank you.
Now let's start with you, Carol. You were 14 days old when you had surgery on your little baby heart 50 years ago. tell us a little bit about what you knew about your condition growing up.
I actually didn't know a lot about my condition growing up. It's something that I've had to piece together the last couple of years with the knowledge that's come available to me. I knew I was short of breath. I knew I struggled to keep up with my friends. I knew I had a big zipper scar, but other than that, we didn't have a lot of awareness or support.
Now, what was your condition?
My right pulmonary artery was coming from the aorta, so it needed to be removed essentially and attached to where it should be. Dr. Soni would know more about that.
And this is a very rare condition, right, Dr. Soni?
Extremely rare. Her particular type is extremely rare, and I've been doing this for 30 years. I haven't had a patient with that.
Never seen it. No. And so imagine 50 years ago with the technology and medical science at that point.
Absolutely.
Can you just understand how unbelievable that would have been?
It's quite remarkable that they made the diagnosis and 50 years ago were able to surgically correct it. Yes.
Okay, so we find that more patients are living longer, right? Correct. And so normally what would happen, let's say 20 years ago?
So 20 years ago, once the diagnosis was made for her particular lesion, yes, the correction would have been the same as what she had. The artery would have been taken off the wrong place and reconnected to the correct place. I think what's improved since then is surgical techniques, the machines that you need to put a baby onto a heart-lung bypass machine, for example, the post-operative care, and it's not just the surgery, it's all the aftercare. For example, her artery was still small, it needed to be enlarged down the road with other types of non-surgical procedures. All of those things were in their infancy, 20 years ago.
Okay, but typically what would happen for anyone who had CHD, they wouldn't survive this long, right? Is that the issue?
Going back 30, 40 years ago, there was a good chance they wouldn't. For example, one common complex condition that we see, it's called hypoplastic left heart syndrome. There was no surgery even possible for that prior to 1985. When I started working about 27, 28 years ago, there was 100% mortality with the operation. Wow. Now that mortality is down to 7-8%.
Wow, and so you're seeing those patients live longer.
Absolutely.
And
yes.
so they're going from pediatric care, pediatric care to adult care. And so what are the challenges with that transition right now, even today?
So I think the challenges that we're trying to work together as adult and pediatric, collaborative team is to make that transition smooth. I think first of all, there's a translation of the medical knowledge, everything that we've accumulated over those 18 years to make sure that correct knowledge translates over to the adult system. There's education of the patient. They were obviously a very small child or baby when they had all of their surgical work done typically. So it's about empowering them with that knowledge so that going forward as adults, they know what their active care needs to be, and they can advocate for that. And then it's the whole, parents are so involved as their children. Right. It's about, giving that autonomy over to the child, but still letting them be involved, because that's been their role the entire time. And then as an adult, you have issues with employability, issues with, for women wanting to potentially have children, all of those extra aspects of care that have to be addressed and that requires the resources to address it.
Carol, did you face some of those challenges?
No, because there wasn't the awareness. I had 2 healthy pregnancies, but under no supervision of a cardiologist. But that is part of the gap we're talking about. I didn't have we need to build that bridge between pediatric to adult, and there was a span of about 15 years where I did not have a cardiologist.
Wow.
Yeah.
And you got lucky.
I got lucky.
And
I had 2 healthy pregnancies, but I was not in even high risk. I did not have supervision of a cardiologist. Yeah.
And so how is life today for you?
Life today is honestly ideal. I try to manage my symptoms, listen to my body, but lead a balanced life outside of my diagnosis. And I'm really trying to turn my attention to being an advocate and an ally and just living a full life.
What do you want other CHD patients to know? What can we do better to help them transition from pediatric to adult care?
Well, I think they have to be an active part of the process, right? It's not enough about the medical professionals trying to fix the transition process. Okay. It has to be a very family-centered process. One thing we're doing now is when when the teenagers are 17 or so, we're doing a combined clinic with the adult team and the pediatric team together at Children's Hospital, so that's in the comfortable environment that they've grown up in, but introducing the new team in.
Oh, okay, cool.
So that's something I hope will go a long way in smoothing out some of the bumps.
We're getting better.
Yeah.
Okay, well, thank you to both of you.
Thank you so much.
And thanks for sharing your story.
Thank you so much.
Thank you for having us.